Welcome to Mind Matters, where we explore the pressing issues impacting our mental well being. Today, we're examining one of the most profound and ongoing effects of the global pandemic: the impact of COVID-19 on mental health. The pandemic has reshaped every aspect of life: our physical health, social interactions, economies, and perhaps most significantly, our mental health. While we're beginning to move past the immediate crisis, the psychological effects may persist for years. The psychological toll of COVID 19 has been widespread and diverse. No one has been immune. From children to the elderly, everyone has experienced the stress of lockdowns, isolation, and the loss of normalcy. While the world initially focused on physical health and safety, the long term consequences on mental health have become increasingly clear. For many, the sudden changes in daily life triggered feelings of anxiety, fear, and helplessness. Children and teenagers, disconnected from their peers and school environments, faced disruptions in critical social and developmental stages. Adults struggled to manage new stressors: job insecurity, financial strain, and balancing work with family responsibilities. Children, in particular, are facing a unique set of challenges. Those growing up in an environment of prolonged social isolation, devoid of typical interactions with friends, classmates, and teachers, are at risk of missing out on critical opportunities to develop social skills. Social interactions, whether in school, playgrounds, or extracurricular activities, are fundamental to a child's emotional and social growth. These early experiences help shape communication abilities, empathy, cooperation, and conflict resolution, all essential for future relationships and navigating adult life. But many children, particularly those who were very young when the pandemic began, have missed out on these social experiences. Their world has become more isolated, confined to their home and immediate family, with most interactions taking place through screens. For young children, social isolation can limit their understanding of social norms, emotional regulation, and the ability to connect with peers. As these children grow older, they may face delays in social and emotional development. They may struggle with forming relationships, understanding social cues, or navigating group dynamics. Without the foundational social experiences of early childhood, they may find it challenging to relate to others, feel comfortable in new social settings, or work collaboratively. These gaps could manifest as social anxiety, difficulty in communication, or even behavioral issues as they enter adolescence and adulthood. The consequences of social isolation during childhood won't just be limited to personal development, but will likely affect the future demographics and workforce. As these children grow into adults, many of them may enter the workforce lacking critical interpersonal and social skills that are essential for success in many jobs. The ability to collaborate, communicate effectively, and work in teams, skills that are often nurtured in school settings, may be underdeveloped in this generation, leading to challenges in professional environments. In a future economy that increasingly values collaboration, creativity, and problem solving, a generation that has experienced social isolation may find it harder to adapt to roles that require strong interpersonal skills. Jobs that depend on human interaction, such as leadership, customer service, healthcare, and education, may experience a skills gap, with fewer qualified individuals available to fill these roles. This could lead to lower productivity and innovation in industries where communication and teamwork are essential. Economic inequality could further exacerbate the issue. Children from disadvantaged backgrounds may face even greater challenges if they have had fewer opportunities for structured social interaction and support during the pandemic. Without interventions, this gap could widen in the future, creating a generation of individuals with unequal access to social and professional opportunities. In addition to workplace implications, children growing up with limited social skills may also face challenges in forming long-lasting personal relationships. As these individuals enter adulthood, they may struggle with building meaningful connections, particularly in romantic relationships. The ability to form and maintain intimate relationships is often shaped by early social experiences, which many pandemic-era children have missed out on. This lack of social development could lead to difficulties in establishing long lasting family units. A generation with weakened interpersonal skills may be less likely to form strong romantic partnerships or maintain stable families, which could have broader implications for society. One major effect of this is the potential decline in birth rates, as individuals who struggle with forming lasting relationships may be less likely to start families or have children. Many sociologists and economists are already concerned about declining birth rates in various countries, and the long-term effects of the pandemic could exacerbate this trend. A reduction in the number of family units and lower birth rates could have far-reaching consequences for population growth, economic stability, and social structures. Fewer births mean fewer young people entering the workforce in the future, which could lead to an aging population and strain on social services, healthcare, and retirement systems. Parents and educators will play a crucial role in remediating these social gaps in the coming years. Schools and communities may need to implement special programs that focus on rebuilding social skills, encouraging peer engagement, and providing structured opportunities for children to interact in safe, supportive environments. But for some children, the social cost of the pandemic may leave lasting effects, influencing their ability to connect, empathize, and collaborate well into adulthood. Without the support of daily social interactions, many people felt disconnected from the world around them. Loneliness became a pervasive issue, and for those already vulnerable to mental health problems, the isolation only intensified their struggles. These effects have rippled through all age groups and socioeconomic backgrounds, amplifying feelings of depression and anxiety. The economic fallout from the pandemic has played a crucial role in amplifying mental health challenges. As businesses shuttered and entire industries were disrupted, millions of people faced job losses and financial insecurity. This uncertainty has had a direct effect on mental health, as studies show that people experiencing economic hardship are significantly more likely to develop symptoms of anxiety, depression, and stress. For many, the financial strain created a cycle of distress, worrying about paying bills, keeping a roof over their heads, or affording health care, all while trying to stay mentally strong in a rapidly changing world. This economic anxiety isn't just temporary. Experts warn that financial instability will continue to affect mental health long after the pandemic is over, particularly for those in low-income communities or already vulnerable populations. We are now seeing some alarming trends. Globally, cases of depression and anxiety have more than doubled since the onset of the pandemic. Particularly troubling is the sharp rise in suicide rates, especially among young people and marginalized communities. These numbers reflect the immense psychological burden of prolonged isolation, economic hardship, and fear for the future. Young adults and the general population are particularly at risk. Teenagers and college students, whose lives have been upended by school closures, canceled plans, and a disrupted future, are showing rising rates of anxiety, depression, and self-harm. Adults face their own struggles, balancing the fear of an uncertain economic future with mental exhaustion from prolonged stress. Mental health services, already strained before the pandemic, are now overwhelmed by the growing need for support. The demand for therapy, counseling, and psychiatric care has skyrocketed, and in many places it far exceeds the available resources. The situation is critical. Without adequate intervention, we risk facing a mental health crisis of unprecedented scale. As the world slowly begins to recover from the pandemic, the mental health impact will linger for years to come. Many people are struggling with post-pandemic anxiety, a condition characterized by the fear of returning to public life, interacting with others, and facing new uncertainties. After so much time in isolation, people are finding it difficult to re-engage in normal social activities. This anxiety is particularly pronounced in people who were already vulnerable to mental health issues. For some, the fear of another crisis, new variants, or simply returning to crowded spaces has created social anxiety and a persistent feeling of being unsafe. The trauma of losing loved ones, witnessing the collapse of economies, and enduring months of isolation has left a lasting imprint. As a society, we must prepare for the long-term psychological aftermath of COVID-19. The demand for mental health services will continue to grow, and without the necessary resources, many will struggle to receive the help they need. Governments and organizations need to take immediate action to address this. The future of our quality of life will be deeply influenced by how we manage the long-term effects of the pandemic on mental health. The economic instability caused by the crisis will have lasting consequences on individuals' well-being. Many will continue to face job insecurity, underemployment, and shifting work models, all of which can erode mental resilience. For those struggling to make ends meet, the future can seem uncertain, creating a cycle where economic instability fuels poor mental health, and in turn, mental health issues hinder productivity and long-term planning. Workplace stress, financial burdens, and fear of future pandemics will continue to challenge the mental well-being of millions. Although the challenges ahead are immense, there are solutions that can mitigate the long-term mental health impact of COVID-19. Expanding access to mental health services is critical. Digital platforms, teletherapy, and community-based support systems need to be prioritized to ensure that help is available to all, regardless of their circumstances. Governments and institutions must invest in mental health infrastructure, from funding mental health services to integrating wellness programs into schools and workplaces. Mental health education is also essential. Reducing the stigma around mental health issues will encourage more people to seek help, potentially preventing the escalation of disorders. Workplaces can also play a pivotal role. By creating flexible work environments, offering mental health support, and fostering open communication, employers can help reduce the stress and anxiety many employees now face. Community support systems, whether through peer groups, local organizations, or online forums, can also provide an invaluable lifeline. The impact of COVID-19 on mental health will not disappear overnight, but by recognizing the importance of mental well-being, prioritizing support, and building resilient systems, we can begin to heal. The pandemic may have disrupted our lives, but it has also given us an opportunity to redefine how we approach mental health and create a more compassionate, supportive world. Thank you for joining us on Mind Matters. If this video resonated with you, please like, share, and subscribe to stay informed. Remember, mental health is just as important as physical health, and with the right support, we can all emerge stronger.